Hey everybody, what's up? This is Jeremy with the Southeast Harm Reduction Project, aka Sharp. Today I've got my mate Sharpie, the snippy, smart, sharp shark. Say that 3 times fast. With a quick new rant, unfortunately, about some of the misperceptions about substances, people who use substances and treatment options available to those who want them, especially the area near where I live. So stick around, we'll see you on the other side. So hey everybody, welcome back. Just hopefully a quick little rant today. Frankly, I'm sick of doing rants and writing articles where I complain about these things, and I like to get refocused on education and harm reduction. But I was at an event last night, and I won't mention exactly where out of respect for the person who put it together, but it was an absolute nightmare. I was invited to table for an organization that I work with, and I had the opportunity to speak with some really awesome people before the event, so I was really excited, and I think that kind of set me up for a big letdown when everything after that happened. There was a discussion period, which was more like a 2-hour lecture, and immediately started to go all to hell. And I won't go into too much detail, but there was an Emmy Award-winning local journalist there who put together a terrible investigative series about the overdose problem in Atlanta's affluent suburbs, a problem that they've completely ignored when it was perceived to only be an issue in communities of color or poor rural areas that a lot of us have known about for years and have lived through. They continue to ignore anything that happened outside this triangle of affluence. This was in an affluent suburb. So anyway, I've already written up a rant on that, and I'll include that in the description below. The first thing we were just subjected to right off the rip was triggering images of drugs, people injecting drugs, people cooking up heroin on spoons, just really awful things. And I've already had personal email discussions with this journalist. He knows it was a problem. He knows there were people in recovery in that audience. He knows there were children in that audience, and they did it anyway, and it is what it is. They have an agenda, and this seems like they're more interested in dictating the discussion about recovery rather than listening to the voices of people who have lived experiences and who advocate for multiple paths to recovery rather than the fear and scare tactics that they use to get ratings. But enough about that. I'll include references to everything we talk about in the description below. There were 3 things that really got under my skin. And after this, I might never get invited to one of these events again, but c'est la vie. There was this supposedly expert panel on addiction for the Q&A session after the screening of this awful series. And it included a professional interventionist, 2 judges, county sheriff, the reporters, and a handful of other folks. They told us about how addiction's a disease more than once, but there were no doctors, no medical professionals, no public health professionals on the stage at all. We took a big step back into the 1980s where scare tactics and propaganda ruled the day, and it was just a nightmare. I had visions of Nancy Reagan and Just Say No and Dare and Reefer Madness and all that, so really awful experience. Number 1 big problem. A woman from the audience sincerely asked the sheriff if they were going to start promoting treatment over punishment like they've done in some other jurisdictions. At least he was honest about it. He had absolutely no interest in talking about treatment or diverting people that his department arrests away from jail and prison. And he talked about coercion and how there's these awesome programs in the prison system which only exist on paper. I have personal experience with that, but he said they broke the law and they deserve to be punished, so I don't know what more I can add to that. At least he was honest, which is more than I can say for some of the other folk. Number 2, the county's drug court judge, who went on and on and on about how successful drug courts are, even though we know they're not. We have evidence that they're not, and we know that people who choose drug court end up spending more time incarcerated than if they'd chosen a jail or prison term to begin with. We know that 37% of drug court participants are in there for cannabis-related crimes, and that many more people who are in there have used substances but don't actually have a substance use disorder. So drug courts aren't really doing a lot of good. We know that there are over 3,000 in the country, and they've done absolutely nothing to help with the substance use issues that we're facing. And we know that those success rates are inflated by them cherry-picking cases. And Jennifer Murphy wrote a really excellent book called Illness or Deviance, and on that topic, here's what that looks like. I'll definitely put that in the link below. Most drug courts deny participants medication-assisted treatment with methadone or Suboxone, including this judge's drug court, and they often force participants out of stable MAT programs. I have a friend who died while he was in drug court from an overdose, so I don't have much good to say about them, and I've written about it, and some of y'all have already read that. And the third problem, I learned last night that nicotine is apparently a gateway drug. The drug warriors have lost the argument that marijuana is a gateway drug because it's proven not to be, and so now they're pushing this new line that nicotine is the new gateway drug, which is even more absurd, especially considering that smoking rates have declined dramatically in the U.S. This came from a supposed expert in addiction issues, and I challenge her to prove her nicotine theory or provide evidence of a gateway theory at all. We know chocolate can be habit-forming and produces a rush of dopamine in our brains, and I'm guessing that more than 99% of people with substance use disorders have tried chocolate, so maybe chocolate's the real gateway drug. Come on, we know correlation does not equal causation, so let's get in touch with reality, step into the 21st century, and start promoting healthy, reality-based alternatives to tough love, scare tactics, and fear that interventionists rely on. There was no compassion on that stage, except maybe from the criminal defense attorney who was there and wasn't given much time to talk on anything. There was no effort to understand the substance of this issue. We spent 2 hours hearing about addiction, and never once were the words medication-assisted treatment or harm reduction brought up. There was no mention of mental health issues, which is huge. How can you talk about addiction and substance use disorders and not once mention mental health? And there was also no mention of drug-related suicide, which is something that's often overlooked. Basically, a huge opportunity was wasted last night. I did have an opportunity before and after to meet some really awesome people who gave me some enlightened feedback and kind of redeemed the evening a little bit. And while the people up on the stage were working really hard to erase a lot of the work we've been doing over the past few years in searching for reality-based and evidence-based solutions, I was encouraged by some of the people that I spoke with one-on-one. I do appreciate the opportunity to be there, I really do, but I left that room with a really heavy heart. And I'm optimistic that drug policy reform is happening all across the country, and I've had the privilege of working with our Regional Health and Human Services Office, who is awesome, and the Centers for Disease Control to help connect the dots between government officials and people working on the ground on these issues and people who and directly impacted people. But unfortunately, the message is being ignored and overlooked by the local media, politicians, law enforcement, and judges, and they're stuck in an era that causes more harm, puts more lives in danger, and destroys communities, and they just don't want to listen. So I get spoiled being around people who I feel are enlightened and who are filled with compassion and who understand, or at least try to, and who I really love, and then I get dropped into situations like this, and it's just sometimes it's too much to handle. So this rant might not change much, but our work continues, and it's regular folks like us on the ground who are going to help heal and repair the destruction and damage that these people leave behind. I know that we can make change happen. I know that we're saving lives. I know that we're helping improve quality of life for people who are impacted by the war on drugs and mass incarceration and all these other issues that all connect and which were just totally missed last night. Completely missed opportunity. By people who think that they are doing good. Maybe they have good intentions, but it is what it is. Until next time, thanks for watching. If you're going to use, please practice harm reduction. Stay safe, and